Good morning. Good morning. It is Friday, the 11th of October, and I am in South Florida, happy to be well and have no damage after Hurricane Milton. So I am thrilled to be here with you today, and I hope everybody that is watching is safe and is well. Like I always try to do, please, I encourage you to say something in the comments. I'm happy to have you here. Just let me know you can see me, you can hear me, and we're good to go. Like always, as well, I want to keep this thing going. I'm Carice. I am live every single week talking about myofunctional therapy. I am an international speaker, an author. I do education. I do myofunctional therapy full time with my practice, the Myo Spot. I do consultations to help get myo integratively into dental practices so that they can be not only proficient at it, but profitable. So I like to think that I know what I'm talking about. And there's a lot of different videos. There's over 40 at this point with free education for myofunctional therapy and about the topic of myofunctional therapy. So subscribe, like, share, comment, and we can keep this thing going. I am happy to come on every single week and talk to you about things that I am super passionate about. Okay. This lecture, I think, is highly anticipated, and I don't think I anticipated all of the extra enthusiasm there is about this. And I think that is something that I very much enjoy talking about: perimenopause, menopause, women's health, because women's health is something that we all need to be talking more about. You know, a woman brought us all into this world, and we need to be very mindful, whether you are a woman or are not a woman. We need to be very mindful of women's health and the impact that that has on them, their mental health, their psyche. But more importantly, as we discuss the impact of hormones and that hormone imbalance on women's health and how myofunctional therapy might fit into the mix there. There's going to be some things I talk about. There's going to be some types of recommendations that I have. There's going to be ways that I would recommend OMT with myofunctional therapy integrating into perimenopausal or menopausal care. And so I want to lead in with a disclaimer for this particular lecture that, you know, it's informational and educational purposes only. This is not medical advice. Nothing that I say here should be a substitute for any type of medical advice. You should absolutely, if you are experiencing menopausal symptoms, you're going through the changes, you're going through life in the way that we all do, consult first with your primary care physician, with your own qualified healthcare professional. Okay, so take everything with a grain of salt. All right. Thank you for the comments. I appreciate knowing that you're here with me and that you can hear me and understand everything that's going on. So, perimenopause, menopause, what's happening? Why is it happening? And oh my gosh, it is like a complete upside down on everything you thought you knew about yourself and your body. And essentially, when it comes to perimenopause, all the rules are changing. Like most women, or most girls, I should say, when you're starting your cycle, things are very roller coaster like. It's not stabilized yet. You don't know what the entire length of it is going to be, how frequently it's going to come. It's going to be more irregular. But then you have a nice window of time where things kind of regulate themselves for most people really well. Your hormones come into a nice balance. And so from approximately 10 to 12 until you hit about your mid 30s, sometimes if you're very, very blessed, your mid 40s, you're going to have this wonderful window where your cycles, your menstrual cycles are wonderful and well, and then you'll hit that approximate, it can be anywhere up to 10 years before you hit menopause, that you're in that perimenopause state. And it's just, you have no idea what's going on. Your body can't adequately regulate your hormones. Sometimes you're a little too high, sometimes you're a little too low, and it's just all over the place as far as how you feel and how that manifests in your body. So all the rules and everything you thought you knew about your body effectively changes. And that's when you might get some people who are contacting you as an oral myofunctional therapist, or who might be in your chair or your office as a dental clinician, where they're saying to you, now, you know, everything shifted. My diet, I don't know that I can, manage my weight the same. I haven't changed very much, but my mood's out of control. I don't know if anybody's ever had that moment where like you're very reflective. So you hit these late 30s, early 40s, and you kind of know yourself and who you are. And sometimes things will come out of your mouth that you really don't identify with in your mind. And you're like, wait, did I just say that? That was really rude. Or did that just happen? Like, oh, that was an overreaction. And that's all your wonderful perimenopausal states where your hormones are fluctuating, you're getting the mood swings, and everything you really, really thought you knew about yourself and how you were managing your life and your weight and your health and so forth starts to shift. So what's happening? Chaos, absolute chaos. So perimenopause is really like around any time leading up to around menopause. Menopause is when your menstrual cycle stops completely for a period of 1 year or more. Once you hit menopause, I think they officially medically term it as menopause when you haven't had a menstrual cycle for an entire year. So sometimes you'll go 2 or 3 months without, and then you might get one again. You're not officially in menopause. You'll still be classified as perimenopause, but perimenopause is more characterized by all the irregularities in the hormones. So this is really the population that you heavily want to focus on if you are seeing women that are in their late 30s or most predominantly in their 40s, because it's typically around those early 50s when menopause hits for most women. Not all. There's exceptions to every rule. Nobody follows the same sort of timelines and so forth. But going by the books, women in their 40s are typically your perimenopausal period and time frame. So a lot of them hit estrogen dominance. So estrogen is spiked, okay? And the hormones are very imbalanced. So that progesterone that would typically balance and level out, because in our cycles, it really does come in highs and lows. And that's how we're able to regulate our bodies for the menstrual cycle and dropping the egg and then having the egg after ovulation be expelled by the body along with the uterine lining and so forth, okay? So here's how the hormones work. Oh my gosh, this SD by the testosterone is not supposed to be there. Testosterone is just supposed to like be kind of off into the side. All right, estrogen. Estrogen, as we are ovulating as women, so as you are releasing the egg, estrogen is a high. It's on its peak, okay? We emit high levels of estrogen, and that's where some women might classify themselves as being in PMS. We'll talk about high estrogen and what that looks like and what those signs and symptoms are, but we'll get to that in just a second. I want you to know that that's when it typically peaks. So imagine when you're in an estrogen dominance, as you hit perimenopause, it's kind of that peak ovulation. Some women are very well in tune with when they are ovulating because they feel that spike in the estrogen. Everything starts to shift and change with their sleep, with their allergies, with their skin health, with their cravings and so forth. Everything shifts. So we'll have high estrogen typically when we're in ovulation, when things are nice and regular. When we're in menopause, it just stops producing estrogen entirely. So you go from having lots and lots of estrogen at various periods and times to perimenopause, where it's very irregular, to menopause, where you have none, absolutely zero estrogen. Then there's estradiol, which is lowest during the menstrual cycle. So estrogen and estradiol, very well related, but our estradiol is going to drop, that hormone, during our menstrual cycle. Now, as we're in the cycle, it may produce, it's going to be very low outside of the cycle. It can actually still produce in menopause in other tissues, like in fat cell, around fatty tissue cells. That's where we might produce some estradiol. So estradiol, typically people associate it with the bloating and the water weight retention and so forth. So that's why it might still produce around other tissues that involve fat. Progesterone. Progesterone is highest after ovulation. So estrogen's really high, and then progesterone takes over. So after ovulation, it's really progestation. If you think about progesterone, gestation is essentially there because after ovulation, ideally, the body is hoping that that egg got fertilized. And now it's going to take care of the egg and take care of the womb and nurture the embryo, right? So, highest after ovulation, and it typically will stop if there's nothing that's been fertilized. If there's no need for us to be pro-gestation, then we're going to go back down and we'll come hit that estrogen high again. And testosterone is kind of almost always there in lower levels. That's where it's really responsible for us being higher in a sex drive. You might find that in perimenopause, your testosterone is at its biggest fluctuations and less likely to be as prevalent as you would have liked it to been. Testosterone is really, really good for women as far as us being able to keep and retain muscle mass and us being able to build up that muscle mass. So testosterone is always there in little bits, but what we're fluctuating really in perimenopause is the progesterone, the estradiol, and the estrogen, where our estrogen is going to be big and high at certain stages of that perimenopause. And then we're going to go back on a steep drop from menopause down to no estrogen whatsoever. So it's really a roller coaster ride. And women and our health and our bodies, it's always a roller coaster ride, isn't it? It's something that is absolutely not talked about in any way, shape, or form enough. So when we discount things like perimenopause, that's when we're going to find issues where people are having these changes and these shifts and they can't find the quality answers that they need. So when my sleep starts to shift in perimenopause and I'm very confused because I've never had issues of snoring, or I've never had this, or I've never had that. And a lot of times, if I'm doing consultations for myofunctional therapy and I'm speaking specifically to a woman around that age of perimenopause, and they're asking me why the sudden onset of these sleep problems, and is myofunctional therapy something that they need? Absolutely. Myofunctional therapy can help, but it's always a part of a collaborative process. I 100% stand on that soapbox very firmly. Myofunctional therapy is something that we absolutely can help people with, but almost never is it enough to help people alone. So can myofunctional therapy help? Absolutely. But the hormone imbalances are going to always impact what's going on with your sleep, leading straight into your menopause. So if you're experiencing these night sweats or these different types of symptoms, hot flashes, and you're like, oh my gosh, I didn't even know that I could be in this. I'm only in my early 40s. Like, I had no idea that I could have a hot flash. Well, yeah, perimenopause, you're going to be in that estrogen dominance. You're going to have fluctuations where you might have your estradiol be really low. And then now you're experiencing in short bursts. So it might be a couple of days of symptoms, or it might be a day of symptom, or maybe a couple of hours of symptoms. It's all over the place. Everything's irregular. You don't know how to really manage your body. You're experiencing all these things that some of them mimic menopause and some of them mimic pregnancy, because you're still experiencing some of the traditional things and signs and symptoms of when you are in active menstrual cycles. And so you might have that breast tissue pain, the bloating, and you might have your mood swings and your tiredness and your irritability. And those types of things can be very, very associated with high progesterone. But then you'll have all of your things that are more like it's mimicking your menopause, your night sweats, your hot flashes, your difficulty concentrating, your irregular or skipped cycles. Sometimes for those who are very, very lucky and blessed, during perimenopause, your cycles will be shorter, they could be lighter, and then it's just a lot less than what you've been accustomed to. And in that same way, some of those hormones are also less in that heavy imbalance. But for a lot of women, it winds up being something where everything is kind of ramped up. So now your periods are heavier or longer than you were accustomed to. And so it's a very confusing time. And all the hormones, I know, it's a lot to really take in. I think it's really important to start this out by understanding perimenopause versus menopause and what all of these things really mean. Because when you get into the nitty-gritty of it, it's honestly a lot of just looking in a mirror and not knowing who you are. whose body is this? I can't tell you how many times I've had that same thought where I'm like, what is going on? You might have these mood swings. You might have the hot flashes, or you're waking up and you have insomnia and you have these things that you've never had before in your life. You don't recognize yourself because you're more likely to gain weight. You're more likely to have more cortisol stores because anxiety and stress are higher in these times where you really just cannot recognize yourself. You're looking in the mirror and you're like, who is this? I don't know this person. I don't think I've ever even met this person, and I may not like this person. And so you're really questioning what's going on with the rest of your life. And in the midst of all these things, there's some overlap between some of the things that they're experiencing and some of the things that we would characterize as oral myofunctional disorders, or things that we would characterize as being a consequence of having an oral myofunctional disorder, such as with sleep and the anxiety and changes in breathing and so forth. These are going to be things that we'll look at and we'll be like, oh, okay, well, this is a myo thing, and this is a myo case I should take on. Any myo case you're taking on with someone in the perimenopause state, just be very mindful that there are other considerations you have to take into your treatment planning and your coordination of care. Okay. So estrogen, when it's very high, you get symptoms similar to pregnancy, but when it's very low, it's more likely to menopause. So you'll go through that high and the low and the high and the low. And you'll see in this little graphic here, I really love this graphic here because you'll see the estrogen really high. So 20, 30, 35, even 40. But then you hit like 50, 60, 78, and it's like very, very, very low to no estrogen is being produced. So you're really going to see that high peak of it when you're in your 30s, and then it really starts to dip down sharp and steep after 50 for most women. So when you're in that estrogen dominance really high, that's when you're experiencing things like perimenopause, when you're experiencing things like that breast tenderness, fluid retention, bloating, headaches, migraines, especially around your menstrual cycle. There's a lot of women who talk to me about that whenever I'm asking in myofunctional therapy. If I'm working with a client, I'm asking them, how's everything been going? Those morning headaches you were telling me about, like this, that, and the next. And they'll be like, well, the headaches typically are following my cycle. And so after my cycle, it's really difficult for me to sleep. And then it's a little bit more irregular. I'm having the insomnia and my mind is racing and I just really can't get it back for a few days. And then all of my OMT starts to come back into place and everything sticks again. It's okay. We just have to deal with the cycles of that estrogen dominance coming along. The storing fat around the belly area, so the hips, the thighs, and the stomach, this is going to be a big, big cue. A lot of people will say that they have unexplained weight gain, and that unexplained weight gain comes along with some other things like cravings and so forth. Remember, this is very much similar to pregnancy, and you're feeling all of these highs. So estrogen dominance in perimenopause is not really fun, but low estrogen levels are also going to contribute to some stages of weight gain, but not necessarily a little bit more evenly distributed, whereas weight gain within that stomach or that mid region of the body is more likely in perimenopause. In menopause, it's more throughout the body, that weight gain, that inability to manage your metabolism in the same manner. You'll experience low libido. Frequent UTIs are a big thing that's not talked about enough that we need to talk about more, but having urinary tract infections, what all that means for your pelvic floor and pelvic floor health. Pelvic floor health is incredibly important, but having a low level of estrogen is going to impact the bladder. It is going to impact the vaginal walls. You are going to have issues now with you being more likely to have recurrent UTIs. The night sweats sometimes we associate with various stages of unrestorative sleep for myofunctional therapy. And I'm going to tell you that night sweats in menopausal women and even perimenopausal women are not that uncommon. So not everything has to do with the fact that they are, breathing through their mouth or their tongue is low. Some of these things are hormone imbalances. Okay. And it's really difficult to know where you are because checking your levels, and this is supposed to be like a little GIF or a GIF or whatever you guys use to pronounce the GIF things where they move around, of Run DMC saying it's tricky, tricky, tricky. It's tricky when you're trying to check what the hormone levels are, because naturally, like I mentioned earlier with our cycles, our hormone levels are in constant shift. So whoever's checking your hormone levels would like to check them ideally a little bit after, no, during your menstrual cycle, but not like right when it started. So a little bit after your menstrual cycle has started, a couple of days into it, because then you're probably going to get a better baseline than you would if your cycle is about to start, if you've just ended ovulation, if ovulation is about to start. Like, it's just a little too irregular where things might be. So it might look like you have really high estrogen if you're checking at a time when estrogen would naturally be high. It might look like you have really low progesterone at a time when progesterone would typically be low. Like, we're not checking at any random time just to make sure that your levels are where we want them to be. It's really, really tricky. So sending somebody or asking them to go get their hormone level checked isn't as smooth as you would think it is, because the women's body is complicated. And so there's a lot to consider there. But how does this all cross over into myofunctional therapy? I think the biggest way it crosses over is with allergies and our immune response and how the body will respond to certain types of inflammation. I really like this graphic that's kind of there in the background, because you think you know your body, you think you know how you respond to allergens, you think you have certain allergies, and then you find out, like, what? I am more allergic to something now, or I was never sensitive to certain seasons, and now I'm highly sensitive to those seasons. Well, your estrogen and your estrogen level is going to impact your body's ability to respond to certain allergies and inflammation. So if you're an estrogen dominant, you're going to be more prone to having these lower levels of the allergies. Whereas when you're in low estrogen, you're going to have higher levels of these allergens. So depending on where you are, some people are like, oh, I used to have these seasonal allergies. I used to have hay fever. I got it really bad in my 20s. And then I got into my late 30s and like, I don't have it very much at all. But now that I hit my 40s, it's like all over the place, where now my hay fever is the worst it's ever been my entire life. Low estrogen. You might have worse asthma. If you've had asthma throughout your life and it's not sports induced, it's just general asthma, you might have more asthma impact and more needing of your inhaler and more ability to really respond to what's going on if the estrogen is really low. So it's important that we're keeping that in mind when we're talking about myofunctional therapy, when we're talking about allergies, because we know there's that crossover, right, between mouth breathing, where mouth is not going to filter any of the air that is coming in. It's not going to humidify it. We're not getting nitric oxide. Like, it's supposed to go through the nose. If it's not going through the nose and it's going through the mouth, well, now you're inhaling more of those allergens, which is now going to, in conjunction with your low estrogen, help to increase your flare up. Is that to say that if we eliminate mouth breathing, that it all goes away? Absolutely not. But you're mitigating or reducing some of the associations that might contribute to you having a higher incidence of these allergy responses. So allowing your body to have a better ability to produce histamines and so forth by intake of those allergens by nasal breathing is a fantastic way for us to now kind of mitigate what would naturally be occurring. Sleep also winds up being one of the biggest things. Changes in your estrogen and progesterone levels are going to increase the sleep disturbances. So you'll see a lot more of the complaints with insomnia. Now, myofunctional therapy doesn't directly deal with insomnia. However, snoring, restorative sleep, circadian rhythms, these are all very much things that we talk about with myofunctional therapy, and things that when we're talking sleep hygiene, when we're talking our upper respiratory airway management, and being able to facilitate nasal breathing so that we can get the most amount of oxygen and less pharyngeal collapse during sleep. these are some of the issues. Like snoring is a big sign and an indicator. It's the number one indicator that there might be a need for a check on the sleep quality with a sleep test for obstructive sleep apnea. So hormones actually do impact in the same way the snoring. So you may have people like, I've never snored before, or nobody's ever told me I've snored before, or my partner has never said I snore before. And now suddenly in my late 30s or early 40s or late 40s, now I'm experiencing snoring that I've never had before. Well, your body's more prone to the inflammation. See the slide before. Your body's more prone to the inflammation, especially when you're in estrogen dominance. And so you're going to have more instances of inflammation in that upper respiratory tract and more ability for it to be collapsible. And so that's where you're getting that snoring. Snoring is the sound of air meeting resistance as it's going through and you're breathing at night, or sometimes people daytime snore, which is audible breathing. Less restorative sleep because your cycles are not being routinely reached. And so you might wake more, you're going to have more frequent wakings, and that's going to impact things as well. And so we know that crossover exists between the mouth breathing and the sleep, where there's an increased risk when you're mouth breathing because your mouth is open, your tongue is low. Already the first stages of sleep are muscle relaxation. So your upper respiratory tract becomes more collapsible. And as it becomes more collapsible, with each collapse or longer collapse, you're more likely to have more waking. And so as you have more wake cycles, now your sleep becomes more fragmented, and that becomes a persistent thing that's now impacting your ability to alter through the sleep cycles. So that decreases your restorative sleep ability. And in a very cross-relational way, because it's not direct to mouth breathing, but when that sleep is impacted, you now have increased cortisol production and adrenaline production, both of which are very much associated with our perimenopausal states and having that unregulated or dysregulated, I guess it should be, dysregulated hormone productions. So your cortisol, very well associated with that. There's a lot of talk about cortisol, or maybe it's just my feed because I see a lot of stuff about cortisol on the internet now with social media. But if you go on the TikTok, so many people are talking about it and somatic exercises and things you can do to help reduce your cortisol. A lot of that really doubles over with the perimenopause and the symptoms of perimenopause. However, with the fragmented, with some cases of hyperventilation. So when we talk about mouth breathing, sometimes there is over breathing where you're hyperventilating in a less dramatic way, where you don't have as much exhale as you have inhale, and you're really over breathing in that way, but not quality oxygen. That's going to increase your risk for anxiety, and increased cortisol is always a direct result of increased stress. And so doing myofunctional therapy for those cases and those instances is actually incredibly helpful. What we want to consider is the type of recommendations that we have around perimenopause, because I think not enough people are really talking about some of the natural things that you can do. So there are people who go through hormone replacements, who take a low-level birth control. That way they can help to regulate the body's natural production of some of these hormones and can get themselves a bit more stability. However, there are some natural alternatives that you can use in order to help you regulate. So if you're in estrogen dominant, your liver might not be metabolizing the estrogen in the same way. And so a great way is to use DIM, diinidol methane. So when we use DIM, and DIM is just an extract from broccoli. And so it's a really interesting natural way to, and you get that over the counter, 150 milligrams daily dosage, helps to kind of regulate you a bit more on your estrogen and your body's natural estrogen metabolism. It is a really great way for you to take a natural approach to what would typically be like a hormone replacement via a birth control or so forth. Or progesterone is really well influenced, and our body's ability to produce it is really well influenced by vitamins B6, C, and zinc. B6, we all know where we can get vitamin C, right? Those are our citruses, and we know how we can intake that. A lot of people are using airborne and so forth as a daily method, but you know where you can get vitamin C. Vitamins B6 and zinc are actually really, really great for dietary management around progesterone and higher levels of progesterone, where the lower levels of the estrogen are taking over. It's really hard to self-regulate when you are in perimenopause because you don't know what's going on with your levels. It's just really important to know that when the estrogen is really high, you're going to experience certain things that when the estrogen is really low, it's going to look more like menopause. Estrogen really high, it's going to look more like and mimic more like pregnancy. You would have to really be in tune with your body. So while I like these recommendations, these are things that I think it's really important for you to always talk to your doctor about, though they are things that you can self-regulate and self-acquire. I think it's incredibly important that you are familiar with your primary care physician. That's the I was looking for. You're familiar with your PCP, your primary care physician, and they're familiar with you and your body and your hormone levels, and they're able to tell you like when. Because sometimes people are using the progesterone and having a more progesterone friendly diet for 2 weeks. That way they are really regulating themselves really well during the cycle, leading up to and during the cycle. And then afterwards, the other 2 weeks, they're managing the estrogen with the DIM, and then they're alternating back and forth. So that's something that you can kind of do on your own, but I would 100% always collaborate with a primary care physician. These are just really great suggestions and things that I have found personally, especially the dietary management, to be really, really helpful. There's certain types of proteins that you want to increase. So with vitamin B6, there's certain types of proteins that you want to increase. Having liver and organ meat, more red meat is really good for vitamin B6. Bananas, pistachios, potatoes, turkey, fish, sunflower seeds. Really good. Just increasing some of the proteins that you might have, like pistachios, soybeans, sunflower seeds, bananas. I think are one of my really, really great ones. I'm not so keen on the white rice for the B6, but having the red meats and the organ meats or the liver is very, very good for keeping those levels of B6 up and encouraging your progesterone levels. Foods higher in zinc, again, red meats, pork, oysters, beans, chickpeas, cheddar cheese, tofu. Tofu is a big one. I love this time of year because pumpkin is my absolute favorite. Like if you ever want to be on my good side, just send me a pumpkin munchkin. Like I am all about those. I could eat like 50 of those in a sitting, like almost any time of year. But pumpkin seeds also very, very good, equally good. I really love snacking on those as well. Pumpkin seeds, high in zinc. Managing your B6, your C, your vitamin C, and your natural zinc is going to be a really great way for you to manage the progesterone. And again, DIM is a really great way for naturally managing estrogen and how that is metabolized in the body, and so that you don't get into too much estrogen dominance. Okay. When it comes to OMT for perimenopause, I would say 100% we want to keep encouraging nasal breathing. Sometimes with the increased stress and increased inflammation, and we can't really respond as well, nasal hygiene routines are incredibly important. They become even more so important than they've ever been before, where now you really want to keep clean these nasal passages and keep them patent as well. So if they're not using a nasal strip or a nasal dilator to help at night with making sure that nasal respiration is occurring, so they're not intaking more allergens. We know most of those allergens are in the room with us, whether it be those pets that we love, whether it be a dust accumulation, it could be from a fan, it could be from not old, but curtains that haven't been washed very recently. Like most of these allergens are occurring in our spaces where we're sleeping. And so you don't want to be mouth breathing at night during sleep because you're more prone to these allergens and inflammation and so forth. And it just exacerbates the issue. And we don't want that. So having that nasal hygiene routine and doubling down on it for those who you know are in that window of perimenopause, late 30s to right about early 50s, that's a really great thing for myofunctional therapy to do. Helping to engage in stress management techniques. So having breath work as a form of our ability to get back in check with our body and to naturally bring us down from what is probably going to be a very sympathetic tone and state to managing our vagal tone back into that parasympathetic level. Absolutely fantastic. Meditation, I've talked about this before. A lot of people think of meditation as something that needs to be done in like a quiet environment and quiet your thoughts and whatever. It's very difficult in this day and age where we are so highly stimulated by all of these electronics. Everybody's got a mini computer in their hands. Everybody has access to things, and immediacy is a big thing. So not getting the ability to sit quietly is very common for most people. So when you do get to sit quietly, you're almost like, I don't know what to do with this. And now your mind is racing and so forth. Meditation, I think, can be as simple as doing a rhythmic breathing exercise. And I think I've talked about this on one or two or other live streams that I've done before. But rhythmic breathing is a great way to start a meditative process or just a conscious breathing process without having to quiet your mind. You can just enjoy what's going on with the music. 60 to 80 beats per minute. You want to have a nice song play, just hit the YouTube, 60 to 80 beats per minute, type it into the search, and it'll give you a nice playlist. You can choose a song from multiple genres that is going to fit. So you can find a song that you like, I guarantee, unless you're like early into heavy metal, you're not going to find a 60 to 80 beats per minute heavy metal song. But for most other genres, you can. So 60 to 80 beats per minute, just want to down regulate your heart rate, and you want to get yourself to a place where you're just allowing your breath to follow the music, to follow the rhythm. The rhythm is going to help your body just kind of self-regulate and bring you down into a more parasympathetic state. So meditation and breath work, really great for those in perimenopause. If they can't get themselves to quiet their minds, a lot of people have commutes. Those who don't have commutes have things that they have to do in the morning routines and so forth. Typically in that age group, these are people who are parenting still or might be in the later stages of parenting. So turn on some music and do some rhythmic breathing while you're creating the kids' lunches, while you are, packing up to go to work, while you are in the shower. Like, do your meditation in a way that still will accommodate into your lifestyle. That way you can manage your stress and you have a technique that's easy to go back to. You can always turn on a song, even if you're at your desk at work and you just pop an ear pod in and you just let it flow. Or if you're working clinically in dentistry, you're like, oh man, I can't even just like pop something into my ear. A lot of times we're able to regulate what's playing in the office. So you could regulate what's playing in the office over the top. I would tell the administrative team, I would tell them, look, I really need to self-regulate because it's perimenopause. I have no shame in saying it. I need to self-regulate because it's perimenopause and y'all don't want this, okay? You don't want these mood swings that are about to come. So let's put on some music that's 60 to 80 beats per minute and we can all down-regulate and we can have a really great day. We can be a fantastic team, okay? I think it's honestly the best policy. Why not? Dietary modifications, it's always important in life to eat as clean as possible, to have foods that are as whole as possible, to really limit the amount of processed foods that you're intaking and so forth. So having an anti-inflammatory natural diet is really, really good. There's so many benefits for keto and being on a keto diet and being in ketosis. And there are some people who are saying that that's really great for perimenopause. I would just say, be mindful for what you're putting into your body and be mindful for what helps when. So when you feel like you would be in higher progesterone, when your body is more likely to be bloated and you're more likely to have irritability and breast pain and so forth, then you want to eat a diet that's more higher in vitamin C's and B6s and zinc and so forth. And so you want to be along the lines that are going to follow where your body is. So just be very mindful and aware of where your body is. Sleep hygiene, incredibly important. So because the insomnia becomes a big thing, it's really important to have tips, tools, and techniques beyond just the myofunctional therapy for how they can manage their circadian rhythm. It's incredibly important to have a consistent bedtime routine. A lot of the images that people have around sleep are really false and misguided, where you feel like you have to have a certain mattress, you have to have a certain pillow, you have to sleep in a certain position. A lot of what we know to be true for oral myofunctional therapy is that you really need to have your oral pharyngeal space be very well managed, in addition to having consistent routines, having patency through the nose so that you can facilitate optimal breathing, having really good tongue posture in the daytime. That way, that mimics and carries through at night, and being able to free up that oral pharyngeal space. So that's all wonderful for our patency and our reduction of the inflammation in that area, and for our ability to better manage allergens and reduce the amount of allergens that are being inspired into the body. But the sleep hygiene overall really should consist of something that's going to help to manage some of the other things that come along. So like, I sleep with a weighted blanket every single night. Anytime I'm away at a conference or away for an event or away for anything that like has me not in my bed with my weighted blanket, is going to be a problem. Weighted blankets are wonderful because in a way they mimic, and not exactly, because it's not the same as grounding. Like, I'm on a grounding pad right now. I'm actually always on a grounding pad when I am at my office. But it's going to mimic grounding in that it's going to regulate the body a little bit more. Your body's able to carry and nurture its own electrons a little bit better. So your electricity management throughout your body is a little bit more contained. But the weighted blanket just also is a great way to just nurture the body. It's like a big hug. And I don't know, not everybody's a hug person, but I'm a big hug person. So it's like a big hug, and it's like a big hug for the entire evening. But having a weighted blanket is a really great thing. It's a really great tool. A lot of times when the electricity is managed, so your energy management is being taken care of, that's when you can also find that you will be respirating better, right? So having other things like them keeping consistent routine, being able to introduce a weighted blanket, being able to introduce strips or a dilator, or for some people, they might even want to do the mouth taping thing. Maybe one day I'll do a live stream about mouth taping and why I'm not a huge fan. Like, it's okay in certain applications, but that's not a big sleep hygiene tip that I like to prescribe to. But having a sleep hygiene routine. So as an oral myofunctional therapist, orofacial myofunctional therapist, orofacial myologist, or whatever you want to call yourself today, it is incredibly important that you have some of these techniques in your toolbox, in addition to just knowing that you helping to eliminate some of the mouth breathing will help them with some of their allergies and some of their sleep issues that they're struggling with. It's incredibly important. But don't forget, you are just one piece of the puzzle. You are not the end all be all. It is not up to us as OMTs to try to solve every issue in the world, to try to be the person who is going to, fix every issue that these people come to us with. It's just your responsibility to make sure that when you are working with these people, that you are connecting them with other members who would see the different piece of the puzzle that needs to be put together with the OMT, so that they can get to a whole body solution. That's the most incredible part of this all, okay? I want to end with this lovely quote from Maya Angelou, that when women take care of their health, they become their own best friends. This is something that I think it's so important to end with, is that a lot of women will find that they just don't get the opportunity to take care of themselves. They don't get the opportunity to explore what's going on with them. We find ourselves taking care of others, whether it be elderly members of our family, whether it be younger members of our family. So if you have children or you have nieces or nephews, whether it be partners, or, taking care of the workplace, or taking care of everybody outside of you. But I want you to treat yourself the way that, if you're a woman, I want you to treat yourself the way that you would treat your very best friend. So take care of self, okay? And yes, there's going to be a lot of days where you do not recognize who this is in the mirror, and you're like, I have no idea when I became this person. It's okay. All things are temporary, and there is a way through. You just have to manage the storm together, with all the pieces of the puzzle put together. I want to thank you for joining me this week. I'm so happy to round it out in a nice little 45 minutes. I didn't even keep you for a whole hour on a Friday. If you have any questions, feel free to pop them in the chat. I'm happy to answer. And I look forward to seeing you again next week. Next week, I believe I'm going to be talking about documentation. So there is a course that I just released, but it doesn't have documentation like notes. And I don't think we talk about that enough. So I think it's going to be a great opportunity for us to chat about note taking. How do you document your screening process for myofunctional therapy? How do you document what it is that you did in a session? And how do you document for insurance purposes if that's something that you're doing? Okay. Thank you all. I hope everybody has a very blessed day and has a fantastic weekend. I look forward to seeing you next time. Bye.